Okay, we're going to demonstrate bag technique, and with clean hands, you've already washed your hands. Your bag is sitting on a clean, dry surface. If you have any concern that the surface is contaminated and you want to protect the bag, a newspaper or a paper towel between the surface and the bag is appropriate. So with clean hands, you're going to go into the bag. First section, you're going to open. You want to have a couple of alcohol wipes handy. And you are going to take out your paper towel. This is the surface that you're going to lay everything on that you might need for your assessment. Stethoscope, blood pressure cuff. You might need a tape measure, scissors, possibly a pen, and you might need some gel. You're going to take out 2 alcohol wipes, one to clean before and possibly before and after. If you have any concern that you're using someone else's bag and you don't know if these are clean or when they were last clean, then clean them before you do your assessment. Otherwise, if you are going from patient to patient and you know you have just cleaned these items before you put them back in your bag last, then you can go ahead without having to re-clean. So we're going to do our assessment. And again, I'm going to assume that I know these are clean because I just cleaned them at my last patient's home. I'm going to do my blood pressure, possibly use my tape measure. If at any time I felt, oh, I missed something, I can go back into the bag, and you've already touched the patient, you're going to use your gel. Wash your hands with the gel, and then go back into the middle of the bag or back here into the front if you need to. So the assessment's been completed, and now we're going to put things back. We're going to take our alcohol wipe and we are going to make sure we wipe off the bell of the stethoscope, possibly any tubing that you think you might have a concern about. That goes back into your bag. The pen, that should be wiped off prior when you take it out, so that if you need to remember vital signs that you think you won't, you can write them on your paper towel on the surface. But if you're going to use that, then of course that needs to be cleaned before and after if there's a concern for contamination. You're going to clean off your scissors. If your scissors are grossly contaminated, I would go to the bathroom sink and use some antimicrobial soap and wash them off with soap and warm water, and then follow up with alcohol just to make sure everything is clean and you've got any gross contamination is rinsed off in their bathroom sink. Probably not want to don't want to use their kitchen sink, I would think, for that. Your thermometer. Gonna wipe off at least the part that might come in contact with their hair and their skin. Put that back in. And of course, this, if you're using this and you pull this out before you even retract it, wipe it, and then it's clean. Clean off the outside if you think there's contamination. Blood pressure cuff. Again, you're going to take your alcohol wipe and do a thorough wipe of whatever might have touched the skin, possibly even tubing if you think there's a question of contamination there. Goes back in. Even wiping off your gel if you've had occasion to use it or you think there's some contamination. Back into your bag. All this would be discarded. Okay, and before you leave the home, wash your hands again. For the patient's protection in the beginning, for your protection on exit, in case you've missed something, and if you're going to go have lunch, wouldn't you really rather have your hands washed after you left that patient's home? Thank you.